You know, for a lot of people, there's just something about going to the dentist that just scares them half to death. My wife is one of those people. Maybe your little one just doesn't want to sit still in the dentist chair. Well, you know, it doesn't have to be that way. Joining us this afternoon to explain why is John Moore, who's the general manager at Peninsula Dental in Millsboro. Thanks for joining us, John.
Thank you for having me.
What is it that scares people so much about the dentist?
Well, I think we all know someone who's afraid to go to the dentist. Maybe they had a bad experience when they were younger. Maybe it's just that they haven't been for so long that they just can't make that phone call and make the next appointment.
And it doesn't have to be that way anymore.
It does not. We're very pleased to be able to offer all levels of sedation dentistry, take all the fear and anxiety out of it.
Now tell me, explain that to me. It's a sleep dental center and you offer sedation. Exactly what does that mean?
Well, we offer all levels from just a little bit of anxiety control, maybe with an oral medicine, some liquid or some pills you can take. Some folks might need a more moderate sedation where we'll use an IV medication, where the patient will be completely awake but absolutely relaxed and have no recollection of any discomfort. And for somebody who wants to just sleep through the entire event, not be aware of anything, there's deep sedation, general anesthesia, and you're just out.
Okay, so if this is something, who would qualify for this? Why would I be a good patient for this?
Really, there are a whole lot of different people who can benefit from sedation dentistry. Many who are otherwise healthy are just plain chicken. They just really can't face going to the dentist without some kind of help. And any one of those options may be for them. It's also ideal for special needs patients, whether children or adults, if they have autism spectrum disorders or cognitive or developmental disabilities. It's just great.
Now, is this the kind of thing that's really only going to apply for like something major, like if I got to do a major root canal or some kind of major surgery?
Absolutely not. We routinely have patients who simply need a cleaning. I'm hesitant to say just a cleaning because really it's not. If you haven't seen a dentist for years, it may even involve more than one visit.
Okay, so help me through. What's going to happen when I want to come to Peninsula? What kind of process can I expect?
Well, first contact is going to be by telephone, and we're going to be able to pre-screen you fairly well by phone. We'll collect insurance information, discuss your medical history, and when you come in for the appointment that day, first off, you're going to need to be fasting, so you won't have had anything to eat or drink since the night before. You'll get to wait in a very comfortable waiting room. We have a nice flat screen TV. We have old magazines. It is the dental office. And after you've been there for hopefully just a few minutes, you'll be taken back to essentially a dental office with a dental chair. But the room is outfitted with state-of-the-art equipment for doing all levels of sedation.
Okay, so I've gone through my procedure, whether anywhere from a cleaning all the way up to a major process. What happens after?
Well, you're going to have a brief recovery time, generally. We have a registered nurse in our recovery room. Depending on the method of anesthesia that you've had, it may be as short as 5 or 10 minutes, generally not longer than 30 to 45 minutes. You're going to be a little woozy, so you can't drive yourself home.
Make sure somebody's there with you or can pick you up.
Yes.
I got to ask you this question, John, because I just want to make sure. You're talking anesthesia. You're talking recovery. Are the people that are in your office, can I trust them to know what it is they're doing?
Absolutely. We have board-certified anesthesiologists on site. We have certified nurse anesthetists who are there. And the dentists who are doing this work have made sedation dentistry a focus of the practice, so they do this all the time.
Okay, and it's not just sitting in the chair that sometimes people are afraid of. They're afraid of the cost.
That's a good point. We understand this and have done everything we can to make it affordable. First off, the sedation aspect of it, by doing it in a dental office as opposed to the hospital or surgery center, literally 10 to 15% of the cost, much, much lower.
How about that?
You're never paying a facility fee, and you're not going to be billed by multiple providers. It's just Peninsula Dental. On top of that, we accept virtually every insurance, Delaware Medicaid for children, and we bill insurance and wait while they pay. Even if we're out-of-network providers for your particular insurance, we're only collecting estimated shares from the patient at the time they're in.
Okay. All right. Now, just to get a better idea and a better feel for what's going on, you have an open house coming up.
We do. May 15th, which is just about 2 weeks away. We're very pleased. It'll be from 9 to 1. If you're still frightened, you can come just have a bite to eat, take a tour of the office. And we're very pleased that we have Governor Jack Markell from Delaware and Alan Levin, who is the Director of Economic Development, coming to speak at the open house and talk about what a great thing this is.
John, thank you so much for joining us this afternoon. Appreciate you coming in and dispelling a lot of things that can cause a lot of fear, so it was great.
Thank you for having me.
Thanks, John. Well, up next on Delmar Life, Brian Spiros is a busy guy. First Jeopardy. Now guess what? He's at the University of Maryland Eastern Shore in Princess Anne. Brian, you're with some pretty well-known ladies.
Well, Jimmy, I'm here with some of the ladies of the UMES women's bowling team. When we come back, we're going to talk about their recent championship win. There's the trophy right there. Plus, they're going to give us some tips about how you can improve your bowling game. And I need mine improved. You're watching Delmar Life. We will be right back.